Hi everyone, I am Dr. Harish Babu Reddy, consultant gastroenterologist at Bangalore Institute of Digestive Sciences in Bangalore. Today I'll be talking about a very important topic, colon cancer screening. As most of us are aware about hearing colon cancer here and there in our family members, as there is a significant global increase in the incidence of this colon cancers due to change in the dietary habits. Usually it used to be a disease of elderly people, but of late we get to see even in the middle-aged people also commonly. So the colon cancer is one of the malignancies which is most commonly attributed to mortality and also for a very poor quality of life, as it is usually diagnosed in the very late stages. So by applying a preventive strategies and appropriate screening, this cancer can be diagnosed in very early stages or even when it is in a precursor or in a polyp stage. Then we can offer a complete curative treatment which can have a significant impact on the quality of life of a patient, and also appropriate screening programs can be followed even after the treatment so that they don't land up with the complications of this disease. Who are the people who are at risk of colon cancers? Colon cancer, as I already told you, usually people who are more than 50 years. Now in Europe and America, the age has been decreased to 45 years as a screening cutoff for the colon cancer screening. Second, people with a family history of any colon cancers, family history of any colonic polyps or any polyposis syndromes, or he himself having a past history of any colon polyp, and people who are obese, people who continue to smoke and take alcohol on a regular basis, and also people who have an inflammatory bowel disease like ulcerative colitis and a Crohn's colitis for more than 8 to 10 years. These are the subgroup of people who are at a risk of colon cancers. So these are the appropriate patients wherein you should be considered for a colon cancer screenings. Then coming to the patients who will come to the OPD with following some of the symptoms wherein we suspect for a colon cancer and apply appropriate screening techniques. The patients who come to us with complaints of blood or a mucus in the stools, or they can have a recent change in their bowel habits, like a person who used to have a regular bowel habits wherein he notices that there's a recent change in terms of frequency going to the washrooms, or change in the consistency, or even sometimes having a constipation. Otherwise, some of the patients on a regular health checkup, when they come to know that their hemoglobin value is progressively decreasing, especially the iron deficiency anemia, and some of the patients can present with significant weight loss without any reason, any other metabolic reason in the body. Then some patients even can present with pain abdomen, or they can even have a feeling of a lump or some mass kind of a thing in the intestine or the lower part, wherein we strongly suspect a colon cancer and apply appropriate screening protocols. So what are the tests which can be applied for a colonoscopy for a colon cancer screening? The first tests are always a stool-based test, wherein a stool occult blood or a stool-based fecal immunochemical test. But however, the sensitivity of these tests is very low, and also the availability of the fecal immunochemical test is not widely available in our country. The most widely used test in our country is the colonoscopy. Colonoscopy is a test wherein we use a long tube inserted from the rectum region to examine the entire colon. At the same time, it helps us to even take a biopsies from the lesions if you suspect anything like that, and also help us to diagnose polyps and cancers in a very early stages and to apply a definitive treatment according to that.